Ken asked us when we had a call the other day to really just use this two to 4 minutes or so to really introduce ourselves and the perspective that we're going to bring to the panel, to really hope that this would be a facilitated discussion across the panel and across the group. So I am a nutrition scientist by training. My undergrad and graduate work are very much based in the nutrition sciences. And I was doing my PhD work in child care centers and really wanted to learn more about using law as a tool to make healthy choice the easy choice for our youngest children. And so I went off to law school, and the risk of doing that, you become a lawyer. So I do think about things both from a science perspective and from a legal perspective. I don't know if there's other lawyers in the room that, you know, were a little uneasy by the promises, or at least the hypothetical promises, promised about this work. But again, it does lend a legal lens to kind of how you think about things in terms of translating it to both practice and policy. Again, kind of thinking personally about the perspective I bring to this and kind of thinking through my building experience. I was a teaching assistant on the American Indian Housing Initiative led by Dave Riley out of Penn State, so I do have some exposure to building, but very limited in that sense, and have worked with environmental policy laws through our AG's office in Illinois. So that's my limited kind of perspective with working with you guys firsthand, but Charles has been very welcoming with the Health and Buildings Initiative here, and so over the last, I think, year and a half or so since the last April meeting we have had here, I've been able to be on calls with you guys and really kind of hear your perspective and learn really what your questions are and kind of needs are regarding the healthy eating and active living space. So from a personal reflection, as a new mom, relatively, I have a 15-month-old, I've spent over 12 months breastfeeding or pumping when I was working. And you spend a lot of time in rooms and in buildings and kind of thinking through how are we making healthy choice the easy choice, and again, breastfeeding is a choice, but how are we making that the easiest choice? I didn't hear it talked about today. We talked a little bit about food, and more so about activity, but never really about breastfeeding. And this is not my area of expertise. Again, just from being a breastfeeding mom, I learned really quickly on what we're doing and not doing in that space. And so, just thinking from like what goes through my mind, this picture was not taken for professional reasons. This was shared with my husband, who is in the construction business, and just kind of, laying down the lines of like what's going on here. So again, as a person, the person who's attached to this pump, I'm very much influenced by my training. I'm fortunate to be a nutrition scientist and have friends and colleagues that are really the experts in how to do this. But it is, as a movement, I think increasing, and we do have a number of initiatives federally and locally and at the state level really helping moms make this an easier choice, and work supports that are really making this happen. And again, with that, social norms and product industry quickly follows, from pumps to hands-free bras, things like that. And the Affordable Care Act really made this pump possible for me and for a number of mothers in the workplace or in general over the last year since its enactment. And this, again, just kind of individually from a building perspective, these are little things that at least I looked for or made me happy when I was spending, 90 minutes a day, so to speak, in some of these rooms. Having an individual room or privacy, a locked door, comfy seat, clean space, lighting, soundproofing, clean air, right? You have to clean up your stuff, and Wi-Fi to do some work. I mean, these are just little things that are a little bonus, but I don't think, again, the health and buildings perspective really are thinking about this. An outlet, particularly in bathrooms, was a bonus. If you couldn't get scheduled rooms, as a number of us working moms who travel to meetings know, it could be a challenge. So again, this room had all these amenities, and they had a comfy chair. So I was thinking they set this up, or were thinking this could possibly happen. But again, the automatic faucet, which again from a water standpoint you guys think is great, really isn't great for the pumping scene. So again, these are just things that, again, from my personal perspective, I kind of think about or spent a lot of time thinking about. And so I don't know exactly how best you do this and make all these things work from a materials perspective, but that's why working and talking to you guys and kind of raising awareness about these issues, it seems like a simple fix, like my husband said. This could easily be made the easier choice. So with that in mind, that's my personal perspective and kind of how I tie in my legal and nutrition lens to these type of issues. But I do work at NIH. That is the hat I wear, and I welcome you, as a number of the panelists from NIH have today. And you can see we have a broad depth of goals for advancing health, and that includes translation. And from a translation perspective, some of the goals, at least in our office, we think about in terms of translating research into practice is investigating the practicality and generalizability of approaches to prevention and treatment with proven efficacy into practice. And some of these approaches we think about are dissemination potential, sustainability, cost effectiveness, reach and effectiveness to diverse populations. Again, the health equity is really important to us, and applicability to real-world settings. I work at the Division of Nutrition Research Coordination, and that's part of working with Charles over the last year or so. We've used this opportunity as a way of kind of coordinating what the federal government is doing in the active living and healthy eating space, and that's really kind of the approach we've taken to my time on these efforts, and really bringing Katrina, who's here, to the call, NCORE that Rachel is representing, bringing these type of initiatives that we have in the healthy eating and active living space to you guys and kind of hearing what your questions are and needs, and so that's where I came in. NCORE, Rachel, I think, gave a great presentation of the things that we're doing in the public health and built environment space, but one thing we're doing as well related to translation is working on getting research used and recognizing that a number of quality research is just not getting out there, and that we have to build the capacity for our research to interact with key sectors like you guys that are here, architects, architecture engineers, planners, the whole gamut, knowing who those end users are and how best to meet your needs. So we're working on kind of figuring out who those end users are across the federal government, and doing some form of literature search to kind of identify what we know in the space of what can be done to get research used. I didn't get the memo that you green folks do not like printed items. So Rachel, with our NCORE staff, we had developed a one-pager, and so I think some of you guys have that. Again, I didn't get the memo, so I apologize for breaking your rules. We also had some handouts, some pamphlets that Rachel and I have with you. So recognizing we did break some rules, we have them, and we've printed them, and we've tailored them to you. So if you want them, please come to Rachel or I, and we could get them to you. So with that, I hand off to Michael.